everybody. We're here today with Dr. Andrew Kirschner. He has a solo practice in Ballackinwood, Pennsylvania. So we're going to talk to him today a little bit about his family practice and primary care element of his practice. So Dr. Kirschner, why don't you start off by telling us why it's important for patients to regularly schedule appointments and go in for checkups with their primary care provider?
Well, over the years, physicians have developed ways of identifying problems for patients and hopefully identifying them before they become a big issue. Things like cholesterol, if you take care of them when you're younger, you don't have to worry about heart disease as you get older. If you have things like reflux, if you take care of that when you're younger, you don't have to worry about ulcerative disease as you get older. So there are certain things that you can look for, both in checkup and physical examination and blood work, that can help identify problems before they become an issue somewhere down the line. So seeing your doctor regularly, getting routine evaluations, getting routine blood work can do a lot to help prevent you from having trouble down the line. So that's probably the best starting point.
Yeah, and in order to prevent that kind of potential issues that they may run into, how often should someone make sure that they're checking in with their primary care provider and making appointments?
Well, it really varies from patient to patient. So if you came to me and you're a new patient, I probably want to see you, for your initial evaluation and then probably once 6 months later, just so I get to know you a little bit better, assuming nothing else happens between those two visits. And then after that, once a year. Now, if you have other underlying health problems, like, you're a diabetic or have other issues that require additional maintenance, we'll probably want to see you a little more frequently than that, but we kind of determine that on a patient-by-patient basis.
Yeah. And, we mentioned a minute ago that you are in a solo practice, which is different than someone who might be working in a large hospital system or something like that. What do you think are the benefits of primary care with a solo practitioner like yourself for patients that come to see you?
Okay, well, first I'll say the disadvantage. The disadvantage is that I don't get to see, or I have no ability to see lots and lots of patients. So our appointments do fill up. But the big advantage is that when you come in, you see me. And so what happens is over time, I get to an established relationship with patients. And I have patients that I have known, since, for 20 years that I've been in practice. I've known them since before they have children, and now I'm treating their adult children. But I've known them for years. I know them personally. I can look them in the eye and I know when there's something bothering them. I have a rapport with them that makes it easier for me to help them find problems and makes it feel more comfortable for them to discuss things with me because they know me and they're not getting a stranger every time they walk through the door. There's nothing wrong with those bigger practices. I don't want to say anything, denigrating, but for my purposes, I know me, I like to see the same doctor. And in some practices, when there's 8 or 10 doctors, you get who's available. And again, you're getting seen, so that's wonderful. But I love having like a rapport with my patients. I love that, I call many of my patients friends and family.
And, this might have kind of already answered this question, but as a solo practitioner, what is your favorite part of being a solo practitioner, of running your own practice?
Well, it's having those established relationships. I love those patients that I've had for so long, but I know how their Aunt Edna's doing. I know, how their children and where their kids are going to school. I love that sort of patient interaction. I sort of like modeled myself after the old country doctor, but with modern technology, and it's worked out pretty nicely. I mean, patients seem to really appreciate it, and I'm grateful for that, actually.
Yeah. So after hearing all this, if someone's interested in, your practice, scheduling an appointment, what is the best way for them to get in contact with you?
Well, they should contact my office directly if they want to schedule an appointment. They can speak with my assistant, and she'll get you into my schedule at 610-617-9355 or 617-WELL, the WELL line. Or you can contact us through the website, which is embedded on the video.
Perfect. Well, thank you so much for taking the time to answer some of our questions today and to get to know your practice a little better.
As always, thank you for taking the time to speak with me.
Have a good day.
You too.